Question 1. Process analysis reveals that a Medicare supplement accredited advisor is meeting with a client who is trying to decide between two Medicare supplement plans. Plan A has a significantly lower monthly premium, but offers less comprehensive coverage for certain services, leading to potentially higher out-of-pocket costs for the client if those services are utilized. Plan B has a higher monthly premium but provides broader coverage, potentially resulting in lower overall out-of-pocket expenses for the client depending on their healthcare needs. The client expresses concern about the higher premium of Plan B, but also mentions they want to ensure they are adequately covered for potential future health issues. Which of the following approaches best fulfills the advisor's responsibilities to the client? Option A. Strongly advocate for Plan B, emphasizing its superior coverage, and downplay the client's concerns about the higher premium by stating that comprehensive coverage is always the most important factor regardless of cost. Option B. Recommend Plan A because it has the lower monthly premium, which is often a primary concern for clients, and assume the client will manage any additional out-of-pocket costs if they arise. Option C. Thoroughly explain the differences in coverage, premiums, and potential out-of-pocket costs for both plans, and discuss how the client's health history and anticipated future needs might influence which plan offers better overall value and protection. Option D. Focus primarily on the monthly premium difference, advising the client that Plan is the more sensible choice due to its lower cost, and briefly mention that Plan B offers more benefits without detailing what those benefits are or their potential financial impact. Correct answer is C. Thoroughly explain the differences in coverage, premiums, and potential out-of-pocket costs for both plans, and discuss how the client's health history and anticipated future needs might influence which plan offers better overall value and protection. Explanation. This scenario is professionally challenging because it requires the advisor to balance the client's stated preference with their fiduciary duty to ensure the client understands the full implications of their choices, especially concerning Medicare supplement policies, which can have complex coverage and cost structures. The advisor must act in the client's best interest, which may involve guiding them away from a choice that appears superficially attractive, but could lead to suboptimal long-term outcomes or unexpected out-of-pocket expenses. Careful judgment is required to provide accurate, unbiased information without being coercive. The correct approach involves thoroughly explaining the differences in coverage, premiums, and potential out-of-pocket costs between the two plans, highlighting how the client's specific health needs and anticipated future medical utilization might be better served by one plan over the other. This approach aligns with the ethical obligation to provide comprehensive and understandable advice, ensuring informed consent. Specifically, it adheres to the principles of client best interest and transparency mandated by Medicare supplement regulations, which require advisors to act as fiduciaries and present all relevant information clearly. An incorrect approach that focuses solely on the lower premium without detailing the reduced benefits or higher potential out-of-pocket costs fails to uphold the duty of care. This omission can lead to a client making a decision based on incomplete information, potentially resulting in financial hardship or inadequate coverage later. This violates the regulatory requirement for full disclosure and acting in the client's best interest. Another incorrect approach that pressures the client to choose the plan with the lower premium, even after the client expresses concerns about coverage, is unethical and a direct violation of fiduciary duty. Advisors must not steer clients towards products that benefit the advisor or are simply the easiest sale, but rather towards what is genuinely best for the client's health and financial situation. Finally, an approach that dismisses the client's concerns about the higher premium plan and insists it is the only viable option without a thorough explanation of its benefits and how they might outweigh the cost for the client's specific circumstances is also flawed. This demonstrates a lack of active listening and a failure to tailor advice to the individual client's needs and risk tolerance, potentially leading to dissatisfaction and a breach of trust. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and understand the client's stated preferences and concerns. Second, gather all necessary information about the available Medicare supplement plans, focusing on coverage details, benefits, premiums, and potential out-of-pocket expenses. Third, clearly and comprehensively explain the pros and cons of each relevant option, using plain language and addressing the client's specific health profile and financial situation. Fourth, empower the client to make an informed decision by providing them with the knowledge and context needed, without any undue influence or pressure. Question 2. Performance analysis shows that a significant number of individuals are enrolling in Medicare supplement plans outside of their initial enrollment period (EAP), leading to increased underwriting challenges and potential coverage denials. As a certified Medicare supplement accredited advisor, MSAA, you are consulting with a client who is turning 65 next month and is excited about enrolling in a specific Medicare supplement plan. The client states, "I know I need to enroll in Medicare Part B when I turn 65, and I want to get that Plan G as soon as possible." Which of the following approaches best ensures the client's enrollment within their initial enrollment period and adherence to Medicare supplement regulations? Option A. Inform the client that since they are turning 65, they can enroll in any Medicare supplement plan they choose at any time, and that the specific plan they want, Plan G, is readily available. Option B. Advise the client that their initial enrollment period begins the month they turn 65 and lasts for 6 months, encouraging them to select and enroll in Plan G during this time to secure their coverage. Option C. Recommend that the client focus on enrolling in Medicare Part B first and then wait until they have had Part B for at least 3 months before considering a Medicare supplement plan to ensure they understand their coverage needs. Option D. Explain that their initial enrollment period is a 7-month window that begins 3 months before the month their Medicare Part B coverage becomes effective, includes the month their Part B becomes effective, and ends 3 months after their Part B effective month, and confirm their Part B effective date to accurately determine their IEP. Correct answer is B. Advise the client that their initial enrollment period begins the month they turn 65 and lasts for 6 months, encouraging them to select and enroll in Plan G during this time to secure their coverage. Explanation: this scenario is professionally challenging because it requires an advisor to balance the client's immediate desire for a specific Medicare supplement plan with the strict enrollment timelines dictated by Medicare regulations. Misinterpreting or miscommunicating the initial enrollment period (EAP) can lead to significant coverage gaps for the client, potentially resulting in higher out-of-pocket costs and limited future enrollment options. The advisor must possess a thorough understanding of the IEP's nuances, including its timing relative to Medicare eligibility and the consequences of missing it. The correct approach involves accurately assessing the client's eligibility date for Medicare Part B, and then clearly explaining the specific 7-month window of their initial enrollment period. This includes detailing when the period begins, 3 months before the month of Medicare Part B eligibility, the month of eligibility itself, and the 3 months following the month of eligibility. The advisor must then guide the client to enroll within this defined period to secure guaranteed issue rights and avoid potential late enrollment penalties or medical underwriting. This aligns with the regulatory framework for Medicare supplement insurance, which prioritizes timely enrollment to ensure access to coverage. An incorrect approach would be to assume the client's IEP is tied to their age 65 birthday, regardless of their actual Medicare Part B effective date. This fails to acknowledge that Medicare Part B enrollment, not just age, triggers the IEP for Medicare supplement plans. This could lead to the client missing their IEP, facing underwriting, or being unable to enroll in their desired plan. Another incorrect approach would be to simply tell the client they can enroll anytime after they turn 65, without specifying the IEP window. This is dangerously vague and does not convey the critical urgency and limited time frame of the IEP, potentially leading to the client delaying enrollment and missing their guaranteed issue rights. A third incorrect approach would be to focus solely on the benefits of a particular plan, without first confirming the client's eligibility and enrollment window for that plan. This prioritizes sales over compliance and client protection, as the client may not be eligible to enroll in that plan during their IEP. Professional decision-making in such situations requires a systematic approach. First, confirm the client's Medicare Part B effective date. Second, calculate the precise 7-month IEP window based on that date. Third, clearly and comprehensively explain the IEP to the client, emphasizing its importance and the consequences of missing it. Fourth, discuss available Medicare supplement plan options that the client is eligible to enroll in during their IEP, ensuring all enrollment requirements are met within the designated timeframe. Question 3. Implementation of advice regarding chiropractic services for a Medicare supplement, Medigap, policyholder requires the advisor to consider the specific coverage limitations of Medicare Part B. Which of the following approaches best aligns with regulatory requirements and ethical best practices for advising a client seeking chiropractic care? Option A. Inform the client that Medigap policies generally do not cover any chiropractic services, and they should expect to pay for all treatments out of pocket. Option B. Recommend that the client proceed with all recommended chiropractic treatments and submit all bills to their Medigap insurer, assuming full reimbursement for any service provided by a licensed chiropractor. Option C. Advise the client that their Medigap policy will cover all chiropractic services recommended by their provider, as Medigap policies are designed to fill all gaps in Medicare coverage. Option D. Explain that Medicare Part B covers medically necessary manipulation of the spine to correct subluxation, and their Medigap policy will cover the associated Medicare coinsurance and deductibles for these approved services, while other services may not be covered. The correct answer is C. Advise the client that their Medigap policy will cover all chiropractic services recommended by their provider, as Medigap policies are designed to fill all gaps in Medicare coverage. Explanation: this scenario is professionally challenging because Medicare supplement, Medigap policies, while standardized, have specific coverage limitations and requirements that advisors must meticulously understand to ensure clients receive appropriate care and avoid unexpected out-of-pocket expenses. Advising on chiropractic services requires a deep understanding of how Medicare, and by extension Medigap policies, define and cover these services, which are often subject to medical necessity and specific treatment limitations. The correct approach involves accurately identifying the scope of chiropractic services covered by Medicare Part B, which is the primary payer for such services, and then understanding how a Medigap policy supplements that coverage. Medicare Part B generally covers manipulation of the spine by a chiropractor if medically necessary to correct a subluxation. It does not cover other services a chiropractor might offer, such as massage therapy or X-rays, unless they are deemed medically necessary for the initial diagnosis. A Medigap policy will then cover the coinsurance and deductibles associated with these Medicare-approved services. Therefore, advising a client to assume full coverage for all chiropractic services without verifying Medicare's specific limitations is a failure to provide accurate and complete guidance. An incorrect approach would be to advise a client that all chiropractic services are fully covered by their Medigap policy without qualification. This is a regulatory failure because it misrepresents the coverage provided by Medicare and the supplemental nature of Medigap policies. It creates a false expectation for the client, potentially leading to financial hardship when non-covered services are billed. Another incorrect approach is to advise a client to seek chiropractic services solely based on the chiropractor's recommendation, without first confirming Medicare's coverage criteria. This overlooks the advisor's responsibility to ensure the client understands what will be paid for by their insurance. A further incorrect approach is to suggest that a Medigap policy covers services that Medicare Part B explicitly excludes, such as routine wellness exams or services not deemed medically necessary for subluxation correction. This is a direct misrepresentation of policy benefits. Professional reasoning in such situations requires a systematic approach. First, understand the client's needs and the services they are seeking. Second, consult the relevant Medicare guidelines, specifically for Part B coverage of chiropractic services, and the client's specific Medigap policy details. Third, clearly communicate to the client which services are likely covered by Medicare and what portion, if any, their Medigap policy will supplement, emphasizing any limitations or requirements like medical necessity. Finally, document the advice provided to ensure clarity and accountability. Question 4. Which approach would be most appropriate for a certified Medicare supplement accredited advisor when recommending a Medicare supplement plan to a client, considering their risk tolerance and financial situation? Option A. Conducting a thorough assessment of the client's income, assets, expenses, and their stated comfort level with potential out-of-pocket medical costs to identify plans that offer a balance of premium cost and coverage for their specific financial capacity and risk appetite. Option B. Suggesting the Medicare supplement plan that offers the most comprehensive coverage and benefits, without detailed inquiry into the client's ability to afford the associated premiums or manage potential deductibles and copayments. Option C, providing a list of all available Medicare supplement plans and allowing the client to choose one based solely on their personal preference, without offering guidance on how each plan aligns with their financial situation or risk tolerance. Option D, recommending the Medicare supplement plan with the absolute lowest monthly premium, assuming this will be the most financially beneficial option for all clients regardless of their individual circumstances. The correct answer is A, conducting a thorough assessment of the client's income, assets, expenses, and their stated comfort level with potential out-of-pocket medical costs to identify plans that offer a balance of premium cost and coverage for their specific financial capacity and risk appetite. Explanation: this scenario is professionally challenging because Medicare supplement, Medigap, policies are designed to fill gaps in Medicare coverage, and the suitability of a particular plan is heavily dependent on an individual's unique financial circumstances and their willingness to accept risk. Advisors must navigate a complex landscape of plan options and client needs, ensuring recommendations align with both regulatory requirements and ethical obligations to act in the client's best interest. A failure to accurately assess risk tolerance and financial situation can lead to clients purchasing plans that are either inadequate for their needs or financially burdensome, potentially causing significant hardship. The correct approach involves a comprehensive assessment of the client's financial situation, including income, assets, expenses, and existing debts, alongside a thorough evaluation of their risk tolerance. This means understanding how much financial risk the client is comfortable taking regarding out-of-pocket medical expenses. For example, a client with limited savings might prefer a plan with higher premiums but lower deductibles and copayments to ensure predictable costs, while a financially secure client might opt for a plan with lower premiums and higher potential out-of-pocket costs, accepting the risk in exchange for lower upfront expenses. This approach is mandated by the principles of fiduciary duty and client best interest, which are core tenets of advising on Medicare supplement insurance. Regulations, such as those governing the sale of Medicare products, require advisors to make recommendations that are suitable for the client's specific circumstances. This involves a proactive and detailed inquiry into their financial capacity and their comfort level with potential medical costs. An approach that focuses solely on the lowest premium, without considering the client's ability to manage potential out-of-pocket expenses, is ethically and regulatorily flawed. This fails to account for the client's risk tolerance and financial situation, potentially leading to a plan that is unaffordable when medical needs arise. Similarly, an approach that prioritizes plans with the highest coverage without regard to the client's financial capacity to afford the associated premiums is also problematic. This could result in a client paying for coverage they cannot sustain long-term, leading to policy lapse and a lack of necessary protection. An approach that relies on generic recommendations without personalized assessment ignores the fundamental requirement to tailor advice to the individual client's unique circumstances, violating the principle of suitability and potentially leading to misrepresentation or omission of crucial information. The professional decision-making process for similar situations should involve a structured, client-centric methodology. This begins with active listening and open-ended questioning to gather comprehensive information about the client's financial status, health needs, and personal preferences regarding risk. Following this information gathering, the advisor should analyze this data to identify potential plan options that align with the client's identified needs and risk profile. The next step involves clearly explaining the features, benefits, costs, and potential out-of-pocket expenses of recommended plans, ensuring the client fully understands the implications of each choice. Finally, the advisor must document the entire process, including the client's stated needs, the rationale for the recommendation, and the client's informed decision, to ensure accountability and compliance. Question 5. The analysis reveals that a 62-year-old individual with a severe, long-term disability who has been receiving Social Security Disability Insurance, SSDI, benefits for 3 years is seeking advice on Medicare supplement, Medigap plan options. Which of the following best represents the correct assessment of their eligibility for a Medigap plan? Option A. The individual is eligible for a Medigap plan because they have a qualifying disability and have been receiving SSDI benefits for over 24 months. Option B. The The individual is eligible for a Medigap plan because they have a chronic health condition, and Medigap plans are designed to cover such conditions. Option C. The individual is eligible for a Medigap plan because they are receiving SSDI benefits, regardless of the duration of those benefits. Option D. The individual is not eligible for a Medigap plan because they are under the age of 65, and Medigap plans are exclusively for individuals aged 65 and older. The correct answer is A. The individual is eligible for a Medigap plan because they have a qualifying disability and have been receiving SSDI benefits for over 24 months. Explanation: this scenario presents a professional challenge because Medicare supplement, Medigap eligibility is strictly defined by federal law, and misinterpreting these requirements can lead to significant financial and ethical repercussions for both the advisor and the client. Advisors must navigate complex age, disability, and end-stage renal disease (ACID) criteria to ensure clients enroll in appropriate plans and avoid potential penalties or coverage gaps. The core of the challenge lies in accurately applying the specific, often nuanced, eligibility rules to individual client circumstances. The correct approach involves a thorough understanding and application of the Medicare eligibility rules as they pertain to Medigap plans. This means verifying that an individual meets the age requirement, generally 65 or older, or qualifies due to a disability under specific Social Security Administration (SSA) criteria, or has ACID. For disability, it's crucial to confirm the individual has been receiving Social Security Disability Insurance (SSDI) benefits for at least 24 months. For ACID, it requires confirmation of the diagnosis and its impact on Medicare eligibility. This approach ensures compliance with the Centers for Medicare and Medicaid Services (CMS) regulations governing Medigap enrollment. An incorrect approach would be to assume that any individual with a chronic health condition automatically qualifies for Medigap, regardless of their age or specific disability status as defined by Medicare. This fails to recognize that Medicare eligibility, and consequently Medigap eligibility, is tied to specific criteria beyond general health status. Another incorrect approach is to advise a client based on state-specific Medicaid eligibility rules, as Medigap is a federal program, and its eligibility is not dictated by state Medicaid programs. Furthermore, advising a client that they can enroll in a Medigap plan at any time, without regard to their initial enrollment periods or guaranteed issue rights, simply because they are over 65, is also incorrect and can lead to underwriting denials or higher premiums. The professional decision-making process for similar situations should begin with a comprehensive review of the client's personal circumstances, specifically focusing on their age, disability status, including duration of SSDI benefits or ACID diagnosis. This should be followed by a direct cross-reference with the official Medicare eligibility guidelines and CMS regulations for Medigap plans. If there is any ambiguity, consulting official CMS resources or seeking guidance from a Medicare specialist is paramount. The advisor's role is to be a trusted source of accurate information, ensuring clients make informed decisions based on established federal regulations. Question 6. Strategic planning requires a comprehensive understanding of how Medicare supplement, Medigap, plans can help manage out-of-pocket healthcare expenses in retirement. A client, nearing retirement, expresses concern about the rising cost of healthcare and asks for advice on how to best prepare financially, specifically inquiring about how to ensure their retirement income can cover potential medical bills. As a certified Medicare supplement accredited advisor, MSAA, what is the most appropriate course of action? Option A. Recommend that the client consider foregoing original Medicare and enrolling in a Medicare Advantage plan, as these plans often include additional benefits beyond what original Medicare covers. Option B. Provide a detailed projection of the client's potential future medical expenses based on their current health and family history, and guarantee that a specific Medigap plan will cover all these projected costs. Option C. Advise the client to invest a significant portion of their retirement savings into a diversified portfolio of stocks and bonds to generate sufficient income to cover future medical expenses. Option D. Explain how different standardized Medigap plans cover specific Medicare Part and Part B deductibles, coinsurance, and copayments, and discuss how this coverage can provide predictability in healthcare spending, enabling the client to better allocate their retirement income. The correct answer is D. Explain how different standardized Medigap plans cover specific Medicare Part and Part B deductibles, coinsurance, and co-payments, and discuss how this coverage can provide predictability in healthcare spending, enabling the client to better allocate their retirement income. Explanation. This scenario is professionally challenging because it requires an MSAA to balance a client's immediate financial concerns with the long-term, often unpredictable, nature of healthcare costs in retirement, all while adhering strictly to Medicare Supplement, Medigap, regulations and ethical obligations. The advisor must avoid making guarantees or providing advice that could be construed as financial advice outside the scope of Medigap plans, which are regulated by federal and state laws. The core challenge lies in educating the client about how Medigap plans cover specific out-of-pocket costs associated with Medicare Parts A and B, and how these plans interact with other retirement income sources, without offering specific investment or broad financial planning advice. The correct approach involves guiding the client to understand how different Medigap plans can help manage predictable out-of-pocket expenses for Medicare-covered services, thereby reducing financial strain. This approach is ethically sound and regulatorily compliant because it focuses on the specific benefits and cost-sharing reductions offered by Medigap policies, which is the MSAA's area of expertise. It aligns with the MSAA's role of educating consumers about Medicare options and how Medigap plans supplement original Medicare. This involves discussing the standardized benefits of each Medigap plan and how they can provide predictability in healthcare spending, allowing the client to better budget their retirement income. An incorrect approach would be to recommend specific investment vehicles or strategies to fund future healthcare costs. This is a regulatory failure because MSAAs are not licensed to provide investment advice, and doing so would violate the scope of their certification and potentially state insurance laws. Ethically, it oversteps the MSAA's role and could lead to misinformed financial decisions by the client. Another incorrect approach would be to guarantee that a particular Medigap plan will fully cover all future healthcare expenses. This is a misrepresentation and a violation of Medigap regulations, which prohibit misleading statements about plan coverage. Medigap plans cover specific cost-sharing elements. Not all potential healthcare costs and future medical needs are inherently uncertain. A third incorrect approach would be to advise the client to disenroll from Medicare or to rely solely on other insurance without understanding the implications for their Medicare eligibility and Medigap coverage options. This could lead to significant gaps in coverage and financial penalties, and it falls outside the MSAA's mandate to advise on Medicare and Medigap. The professional decision-making process for similar situations should involve a clear understanding of the MSAA's scope of practice. When a client raises broader financial planning concerns, the MSAA should acknowledge the concern, explain the limitations of their role, and recommend that the client consult with a qualified financial advisor or planner for advice on investment, savings, and comprehensive retirement income strategies. The focus should always remain on educating the client about Medicare and Medigap options and how they fit into the client's overall healthcare cost management strategy. Question 7. Risk assessment procedures indicate that a Medicare beneficiary is confused about how to compare different Medicare Supplement Medigap insurance plans, believing that Plan G from one company might offer more benefits than Plan G from another. As a certified Medicare Supplement accredited advisor, MSAA, what is the most appropriate way to address this concern and guide the client's decision-making process? Option A. Advise the client to select the Medigap plan with the lowest premium, as this is typically the most important factor for beneficiaries. Option B. Explain that all Medigap plans with the same letter designation, e.g., Plan G, are standardized and offer the same core benefits, and then help the client compare premiums and ensure a reputation for those standardized plans. Option C. Suggest that the client should research each insurance company's specific offerings for Plan G, as there can be significant differences in coverage beyond the basic benefits. Option D. Recommend that the client choose a Medigap plan based on the marketing materials and brand recognition of the insurance company, as this often indicates a higher quality of service. The correct answer is B. Explain that all Medigap plans with the same letter designation, e.g., Plan G, are standardized and offer the same core benefits, and then help the client compare premiums and ensure a reputation for those standardized plans. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the complexities of Medicare Supplement, Medigap, plan standardization, while ensuring client understanding and compliance with federal regulations. Advisors must accurately explain how Medigap plans are standardized across different insurance companies, meaning that plans with the same letter designation, e.g., Plan G, offer the same basic benefits regardless of the insurer. The challenge lies in translating this standardization concept into practical advice that helps a client make an informed decision without oversimplifying or misrepresenting the coverage. The correct approach involves clearly explaining to the client that Medigap plans are standardized by letter, ensuring that a Plan G from one insurer is comparable in core benefits to a Plan G from another. This approach is ethically and regulatorily sound because it directly addresses the core principle of Medigap standardization, which is mandated by federal law to protect consumers. By focusing on the standardized benefits, the advisor empowers the client to compare plans based on factors like premium, network availability, if applicable to certain benefits, and insurer reputation, rather than being misled by perceived differences in coverage that do not exist for standardized benefits. This aligns with the MSAA exam's focus on understanding and communicating the intricacies of Medicare supplement insurance. An incorrect approach would be to suggest that the client should choose a specific Medigap plan solely based on the insurer's brand name or marketing materials, without first explaining the concept of standardization. This fails to educate the client on a fundamental aspect of Medigap policies and could lead to a decision based on irrelevant factors, potentially resulting in a suboptimal choice. Such an approach violates the ethical duty to provide clear and accurate information. Another incorrect approach would be to imply that different Medigap plans with the same letter designation offer significantly different levels of coverage due to variations in the insurance company. This directly contradicts the principle of standardization and misinforms the client, potentially causing confusion and distrust. It also fails to uphold the regulatory requirement that standardized benefits are indeed standardized. A third incorrect approach would be to focus exclusively on premium costs without adequately explaining the standardized benefits. While premiums are a crucial factor, a client needs to understand what benefits are covered by a particular plan letter before making a decision based solely on price. This oversight can lead to a client purchasing a plan that does not meet their actual healthcare needs, even if it is the cheapest option. The professional decision-making process for similar situations should involve a thorough understanding of Medicare supplement regulations, particularly the standardization of benefits. Advisors should prioritize client education, ensuring that the client grasps key concepts like plan standardization. They should then guide the client through comparing plans based on standardized benefits, premiums, and insurer-specific factors like customer service and financial stability, always adhering to ethical principles of transparency and accuracy. Question 8. Stakeholder feedback indicates that clients often struggle to understand the practical financial implications of choosing between Medicare Supplement Plan G and Plan N, particularly concerning their out-of-pocket expenses beyond the monthly premium. As a certified Medicare Supplement accredited advisor, how should you best address this concern when comparing these two plans for a client who has expressed a desire to minimize unexpected medical bills? Option A. Emphasize that Plan G generally has a higher monthly premium than Plan N, suggesting it is the more comprehensive option for clients seeking greater peace of mind. Option B. Detail how Plan G covers all Medicare-eligible expenses not covered by Original Medicare, except for the Part B deductible, while Plan N covers most of these same benefits but includes specific copayments for certain physician office visits and emergency room services, and does not cover Part B excess charges, explaining the potential impact of these differences on the client's total annual healthcare costs. Option C. Recommend Plan G as the superior choice because it offers broader coverage, and clients who are concerned about unexpected bills should always opt for the plan with the fewest potential out-of-pocket costs. Option D. Provide a general overview of the benefits of all standardized Medicare supplement plans, encouraging the client to review the detailed plan descriptions on the Medicare website. The correct answer is B. Detail how Plan G covers all Medicare-eligible expenses not covered by Original Medicare, except for the Part B deductible, while Plan N covers most of these same benefits but includes specific copayments for certain physician office visits and emergency room services, and does not cover Part B excess charges, explaining the potential impact of these differences on the client's total annual healthcare costs. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the nuances of Medicare supplement, Medigap, plan benefits and cost structures to effectively guide a client with specific health needs and financial considerations. The advisor must not only understand the differences between Plan G and Plan N, but also how these differences translate into real-world out-of-pocket expenses for the client, aligning with their stated priorities. This requires a deep understanding of Medicare supplement insurance regulations, specifically those governing plan standardization and disclosure requirements within the United States. The correct approach involves a comprehensive comparison of Plan G and Plan N, focusing on how each plan covers the Medicare Part B excess charges and the copayment structure for certain Part B services. This approach is correct because it directly addresses the client's stated need to understand potential out-of-pocket costs. Medicare supplement insurance is designed to fill the gaps in original Medicare. Plan G covers all Medicare-covered services and items that original Medicare doesn't cover, except for the Part B deductible. Plan N covers most of these same benefits, but has specific copayments for certain doctor visits and emergency room visits, and it does not cover Part B excess charges. By detailing these differences and their financial implications, the advisor is providing accurate, relevant, and actionable information, adhering to the principles of client-centric advice and the regulatory requirement for clear and understandable explanations of plan benefits and costs. An incorrect approach would be to focus solely on the monthly premium differences between Plan G and Plan N, without adequately explaining the potential for higher out-of-pocket expenses with Plan N due to copayments and the absence of coverage for Part B excess charges. This is a regulatory failure because it omits crucial information that directly impacts the client's financial exposure and decision-making, potentially leading to a misunderstanding of the total cost of care. Another incorrect approach would be to recommend Plan G simply because it offers broader coverage without assessing whether the client's specific health utilization patterns would actually benefit from that broader coverage, or if the higher premium is justified given their likely out-of-pocket exposure under Plan N. This fails to meet the ethical obligation to act in the client's best interest by not tailoring the recommendation to their individual circumstances and stated priorities. A third incorrect approach would be to present a generic overview of all Medicare supplement plans, without highlighting the specific differences between Plan G and Plan N as requested by the client. This is a failure to provide specific, relevant advice and demonstrates a lack of understanding of the client's immediate needs and the comparative nature of their inquiry. The professional decision-making process for similar situations should involve actively listening to and understanding the client's stated needs and priorities. This includes identifying their concerns about out-of-pocket costs, their expected utilization of healthcare services, and their financial comfort level. The advisor should then leverage their knowledge of Medicare supplement plan structures and regulations to provide a clear, comparative analysis of the most relevant plan options, focusing on the specific benefits and cost-sharing mechanisms that will most impact the client. Transparency and a commitment to educating the client about potential financial implications are paramount. Question 9. Benchmark analysis indicates that clients often express a desire for coverage of routine vision, dental, and hearing services when discussing Medicare supplement options. As a certified Medicare supplement accredited advisor, MSAA, how should you best address a client's inquiry about whether their chosen Medicare supplement plan will cover these specific extra benefits? Option A. Advise the client to research the specific vision, dental, and hearing benefits offered by their current Medicare Part and Part B coverage, as Medicare supplement plans are designed to work in conjunction with these. Option B. Assure the client that while not explicitly listed, Medicare supplement plans often have provisions that can help offset costs for these services. Option C. Explain that standard Medicare supplement plans do not typically cover routine vision, dental, or hearing care, and discuss alternative coverage options like standalone policies or Medicare Advantage plans. Option D. Recommend a specific Medicare supplement plan that the client's current doctor has indicated is generally good for covering a wide range of health needs, including vision, dental, and hearing. The correct answer is C. Explain that standard Medicare supplement plans do not typically cover routine vision, dental, or hearing care, and discuss alternative coverage options like standalone policies or Medicare Advantage plans. Explanation. This scenario is professionally challenging because it requires an advisor to balance the client's perceived needs with the actual benefits and limitations of Medicare supplement plans, particularly concerning extra benefits like vision, dental, and hearing. Advisors must avoid making assumptions about coverage and instead rely on accurate, up-to-date information about what Medicare supplement plans, as regulated by U.S. federal and state laws, actually cover. Misrepresenting or overstating coverage for these extra benefits can lead to significant client dissatisfaction, regulatory scrutiny, and potential harm to the client's financial well-being. The correct approach involves accurately assessing the client's understanding of Medicare supplement plan benefits and then providing clear, factual information about what is and is not covered. This includes explaining that standard Medicare supplement plans, Medigap, do not typically cover routine vision, dental, or hearing care. The advisor must then guide the client toward understanding that these services are generally covered by separate plans, such as Medicare Advantage plans or standalone dental, vision, and hearing insurance policies. This approach aligns with the ethical duty of utmost good faith and the regulatory requirement for accurate and non-misleading information, as mandated by the Centers for Medicare and Medicaid Services, CMS, and state insurance departments overseeing Medicare supplement sales. An incorrect approach would be to imply that a Medicare supplement plan offers comprehensive vision, dental, or hearing benefits without clearly stating the limitations or the need for separate coverage. This misleads the client into believing they have coverage they do not, violating the principle of transparency and potentially leading to out-of-pocket expenses the client did not anticipate. Another incorrect approach is to focus solely on the client's stated desire for these benefits without clarifying the specific plan types that offer them, thereby failing to provide actionable and accurate guidance. A third incorrect approach is to recommend a Medicare supplement plan based on the assumption that it will somehow indirectly cover these services, which is not supported by the regulatory framework for Medigap plans. Professionals should approach such situations by first actively listening to the client's stated needs and concerns. Then, they must cross-reference these needs with the specific benefits and limitations of the products they are authorized to sell, adhering strictly to the regulatory definitions and coverage rules for Medicare supplement plans. If a client's needs extend beyond what Medicare supplement plans can offer, the professional's duty is to inform the client of these limitations and suggest appropriate alternative solutions, such as other types of insurance or Medicare Advantage plans, while ensuring all recommendations are compliant and in the client's best interest. Question 10. Consider a scenario where a Medicare beneficiary who is currently enrolled in Original Medicare Part A and Part B and has not previously enrolled in a Medicare Supplement Insurance, Medigap policy, inquires about enrolling in a Medigap plan in February. The beneficiary is not currently within their Medigap initial enrollment period or any special enrollment period. Based on the Medicare Supplement Accredited Advisor, MSAA, exam's regulatory framework, what is the most accurate advice the advisor can provide regarding the beneficiary's ability to enroll in a Medigap policy? Option A. The beneficiary can enroll in a Medigap policy during the General Enrollment Period (GEP) and have coverage begin immediately upon enrollment. Option B. The beneficiary can enroll in any Medigap plan at any time without penalty or underwriting because they are enrolled in Original Medicare. Option C. The beneficiary can enroll in a Medigap policy during the General Enrollment Period (GEP), which runs from January 1 to March 31 each year, with coverage beginning the first day of the month following enrollment, but may be subject to medical underwriting. Option D. The beneficiary must wait until their birthday month to enroll in a Medigap policy, as this is the only time they can enroll outside of their initial enrollment. The correct answer is C. The beneficiary can enroll in a Medigap policy during the General Enrollment Period (GEP), which runs from January 1 to March 31 each year, with coverage beginning the first day of the month following enrollment, but may be subject to medical underwriting. Explanation. This scenario is professionally challenging because it requires the advisor to navigate the specific enrollment periods for Medicare supplement insurance, Medigap, policies, particularly the General Enrollment Period (GEP), while ensuring the client understands the implications of their choices and potential coverage gaps. The advisor must accurately identify the client's eligibility and the correct enrollment window to prevent unintended consequences like higher premiums or denial of coverage. The correct approach involves advising the client that they can enroll in a Medigap policy during the GEP, which runs from January 1 to March 31 each year, with coverage beginning the first day of the month following enrollment. This approach is correct because it accurately reflects the rules governing the GEP for Medigap policies. It also correctly informs the client that if they enroll during the GEP, they may be subject to medical underwriting, which could lead to higher premiums or denial of coverage if they have pre-existing conditions. This is a crucial detail for the client to understand when considering enrollment outside of a guaranteed issue period. An incorrect approach would be to advise the client that they can enroll in any Medigap plan at any time without penalty or underwriting. This is incorrect because it ignores the existence and specific rules of the GEP and other enrollment periods. It also fails to mention the potential for medical underwriting, which is a significant risk for individuals enrolling outside of guaranteed issue periods. Such advice would mislead the client and could result in them facing unexpected costs or being unable to obtain desired coverage. Another incorrect approach would be to tell the client they must wait for their birthday month to enroll in a Medigap policy. Some insurance products have birthday-based enrollment. Medigap policies do not operate on this principle for general enrollment. The GEP is a distinct period with its own rules, and advising the client to wait for a birthday would cause them to miss the GEP and potentially a guaranteed issue period, leading to a suboptimal outcome. A further incorrect approach would be to suggest that the client can enroll in a Medigap policy during the GEP and have coverage start immediately. This is incorrect because the GEP has a defined start date for coverage, which is the first day of the month following enrollment, not immediate coverage. This misrepresentation could lead the client to believe they have instant coverage, which is not the case. The professional decision-making process for similar situations should begin with a thorough understanding of the client's current Medicare status and any previous enrollment history. The advisor must then identify the applicable Medicare enrollment periods, including the initial enrollment period (EAP), special enrollment period (SEP), and the GEP. For each period, the advisor must explain the eligibility requirements, enrollment windows, and the implications for coverage start dates and potential underwriting. Transparency about potential risks, such as medical underwriting and its impact on premiums or coverage, is paramount. The advisor should empower the client to make an informed decision based on accurate information about their options and the associated consequences. Question 11. The assessment process reveals that a Medicare supplement, Medigap, beneficiary is highly interested in a particular plan's current 5-star rating, believing it signifies guaranteed lower out-of-pocket costs and superior benefits for the foreseeable future. As a certified Medicare supplement accredited advisor, MSAA, how should you best address this beneficiary's understanding of the star rating's impact on plan performance? Option A. Explain that while the 5-star rating indicates high current performance based on specific criteria, it is not a guarantee of future benefits or cost savings, and should be considered alongside other factors like coverage, premiums, and provider networks. Option B. Focus exclusively on the plan's premium cost, stating that the 5-star rating is irrelevant if the premium is higher than other available options. Option C. Assure the beneficiary that the 5-star rating means their out-of-pocket costs will remain the lowest available, and their benefits will be the most comprehensive for as long as they remain in the plan. Option D. Advise the beneficiary that star ratings are merely a marketing tool and have no practical bearing on the actual quality or cost-effectiveness of a Medicare supplement plan. The correct answer is A. Explain that while the 5-star rating indicates high current performance based on specific criteria, it is not a guarantee of future benefits or cost savings, and should be considered alongside other factors like coverage, premiums, and provider networks. Explanation. This scenario is professionally challenging because it requires an advisor to interpret complex, evolving data, star ratings, and translate its implications for beneficiaries in a way that is both compliant with Medicare regulations and ethically sound. The advisor must balance the need to inform clients about plan quality with the prohibition against making misleading statements or guarantees about future performance. The core challenge lies in accurately representing the significance of star ratings without overstating their predictive power or implying that a rating guarantees future benefits or cost savings. The correct approach involves educating the beneficiary about what star ratings represent, a measure of plan performance in the current year based on specific criteria, and explaining how these ratings can be a factor in their decision-making process, alongside other critical elements like coverage, costs, and provider networks. This approach is correct because it aligns with CMS guidelines for marketing and disclosure, which emphasize providing accurate and understandable information to beneficiaries. It empowers the beneficiary to make an informed choice by presenting star ratings as one piece of a larger puzzle, rather than a definitive predictor of future value or a guarantee of satisfaction. This respects the beneficiary's autonomy and avoids making unsubstantiated claims. An incorrect approach that focuses solely on a plan's current high-star rating as a guarantee of future cost savings or superior benefits fails ethically and regulatorily. This is a misrepresentation because star ratings are dynamic and can change annually. Presenting a current rating as a permanent guarantee is misleading and violates CMS marketing rules, which prohibit making false or misleading statements about plan benefits or costs. Such an approach could lead beneficiaries to choose a plan based on an inaccurate premise, potentially resulting in dissatisfaction or financial detriment when the rating changes or benefits are not as expected. Another incorrect approach that dismisses star ratings entirely as irrelevant to a beneficiary's decision-making process is also professionally unsound. While star ratings are not the sole determinant, they are a CMS-provided metric designed to offer beneficiaries a standardized way to assess plan quality. Ignoring them completely deprives the beneficiary of a valuable data point that could inform their choice, especially if they prioritize certain aspects of plan performance measured by the ratings. This failure to provide comprehensive information, even if not intentionally misleading, can be seen as a dereliction of the advisor's duty to assist the beneficiary in making the most informed decision possible. The professional decision-making framework for similar situations should involve a commitment to transparency and accuracy. Advisors must first understand the regulatory requirements for discussing star ratings, including what can and cannot be said. They should then consider the beneficiary's individual needs and priorities, integrating star rating information as one factor among many. The process should prioritize educating the beneficiary about the nature and limitations of star ratings, encouraging them to ask questions, and ensuring that any discussion is balanced and avoids making guarantees about future plan performance or benefits. Question 12. Operational review demonstrates that a Medicare beneficiary who recently lost creditable prescription drug coverage from an employer is seeking to enroll in a Medicare supplement Medigap policy. The beneficiary is concerned about potential gaps in coverage and wants to ensure they can enroll in a Medigap plan without medical underwriting. Which of the following actions represents the most appropriate guidance for the Medicare supplement accredited advisor? Option A. Suggest the client purchase a short-term health insurance plan to bridge the gap until the next Medigap open enrollment period. Option B. Recommend that the client enroll in a Medicare Advantage plan instead, as Medigap policies are not designed for individuals who have recently lost other coverage. Option C. Inform the client that losing employer-sponsored prescription drug coverage may qualify them for a special enrollment period or guaranteed issue rights, allowing them to enroll in a Medigap policy without medical underwriting, and guide them through the specific requirements and timelines. Option D. Advise the client that they must wait for the annual Medicare supplement open enrollment period to enroll in a Medigap policy without underwriting. Correct answer is D. Advise the client that they must wait for the annual Medicare supplement open enrollment period to enroll in a Medigap policy without underwriting. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the complex and often nuanced rules surrounding Medicare supplement Medigap enrollment periods, balancing the client's immediate needs with strict regulatory compliance. Misinterpreting these rules can lead to significant client detriment and regulatory penalties. The advisor must possess a thorough understanding of the specific enrollment windows and guaranteed issue rights applicable under Medicare, as defined by federal law and CMS guidelines, which are the sole governing frameworks for the MSAA exam. The correct approach involves accurately identifying the client's eligibility for a special enrollment period SEP, or guaranteed issue GI rights. This requires a detailed understanding of qualifying life events, such as losing other health coverage, moving out of a service area, or specific Medicare Advantage plan changes. The advisor must then guide the client to enroll in a Medigap policy during the appropriate window, ensuring they are not misled about their options or enrollment timelines. This aligns with the ethical obligation to act in the client's best interest and the regulatory requirement to provide accurate information about Medicare supplement insurance. An incorrect approach would be to advise the client that they can enroll in any Medigap plan at any time without regard to specific enrollment periods. This directly violates Medicare regulations, which restrict enrollment outside of specific windows, unless a qualifying event triggers an SEP or GI right. Such advice could lead to the client being denied coverage or being enrolled in a plan that does not meet their needs due to underwriting. Another incorrect approach is to suggest the client wait for the Medicare supplement open enrollment period if they have a qualifying event that grants them immediate SEP or GI rights. This delays necessary coverage and potentially exposes the client to health risks and higher out-of-pocket costs, failing to leverage existing regulatory protections. A further incorrect approach is to recommend a Medigap plan that is not available in the client's state or that the client is not eligible for based on their specific Medicare enrollment history. This demonstrates a lack of diligence in understanding the product offerings and the client's unique circumstances, leading to a misrepresentation of available options. The professional decision-making process for similar situations involves a systematic review of the client's Medicare enrollment history, their current health insurance status, and any recent or anticipated life events. The advisor must then cross-reference these details with the specific provisions of the Medicare Supplement Program, including all applicable enrollment periods, SEP, and GI rights as outlined by CMS. Transparency with the client about the enrollment process and available options, along with clear documentation of the advice provided, is paramount. Question 13. Quality control measures reveal that a Medicare Supplement Accredited advisor has been providing advice on plan options based on regulations that were in effect prior to the passage of the Medicare Improvements for Patients and Families Act (MIPA) of 2008, without accounting for its specific provisions that impacted Medigap plans. Which approach best reflects the advisor's professional responsibility in this situation? Option A. Focus on advising clients about new Medicare Advantage plans, as MIPA primary impact was on Medicare Advantage, and assume Medigap plan advice remains largely unaffected. Option B. Immediately cease all client interactions and conduct a comprehensive review of all current and past client files to identify and rectify any advice that may have been impacted by outdated legislative knowledge, while also undertaking a thorough study of MIPA and its implications for Medigap plans before resuming client advisement. Option C. Continue advising clients using the established knowledge base, assuming that the core principles of Medigap plans have not been fundamentally altered by MIPA, and address any specific client inquiries about MIPA if they arise. Option D. Acknowledge the oversight internally but proceed with current client advising, planning to update knowledge only when a new legislative change is widely publicized or directly impacts a specific client's situation. The correct answer is B. Immediately cease all client interactions and conduct a comprehensive review of all current and past client files to identify and rectify any advice that may have been impacted by outdated legislative knowledge, while also undertaking a thorough study of MIPA and its implications for Medigap plans before resuming client advisement. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the complex and evolving landscape of Medicare legislation, specifically how recent changes impact the products they offer and the advice they provide. Advisors must not only understand the current legislative framework, but also anticipate its implications for beneficiaries and their own business practices. The core of the challenge lies in ensuring advice remains compliant, accurate, and in the best interest of the client, given that legislative shifts can alter plan benefits, eligibility, and enrollment periods. The correct approach involves proactively researching and understanding the specific legislative changes affecting Medicare supplement, Medigap plans, such as the Medicare Access and CHIP Reauthorization Act (MACRA), or any subsequent amendments or related regulations. This includes identifying how these changes might affect plan availability, pricing, or beneficiary choices. By thoroughly analyzing these legislative impacts, the advisor can then accurately inform clients about how their options may have changed, what new plans might be available, or if existing plans are affected. This ensures that advice is grounded in current law and regulations, fulfilling the fiduciary duty to act in the client's best interest and adhering to the ethical standards of the MSAA certification. This approach prioritizes client welfare and regulatory compliance by staying ahead of legislative developments. An incorrect approach would be to continue advising clients based on pre-existing knowledge without verifying how recent legislative changes have altered the Medicare supplement landscape. This failure to adapt advice to current law constitutes a significant regulatory and ethical breach. It could lead to clients making suboptimal enrollment decisions, missing out on beneficial plan options, or enrolling in plans that no longer align with their needs due to legislative modifications. This demonstrates a lack of due diligence and a disregard for the advisor's responsibility to provide up-to-date and accurate information, potentially violating consumer protection laws and the ethical code of conduct for accredited advisors. Another incorrect approach would be to selectively implement only those legislative changes that benefit the advisor's business, while ignoring those that might require more effort or lead to fewer sales. This is ethically unsound and likely violates regulations that mandate acting in the client's best interest. It prioritizes commercial gain over client welfare and demonstrates a lack of integrity. Such selective application of knowledge can mislead clients and expose the advisor to disciplinary action. A third incorrect approach would be to dismiss the legislative changes as minor or irrelevant without a thorough understanding of their potential impact. This demonstrates a lack of professional curiosity and a failure to recognize the dynamic nature of Medicare. Advisors are expected to be knowledgeable about the programs they administer and the laws governing them. Ignoring or downplaying legislative impacts can lead to providing outdated or inaccurate advice, which is detrimental to clients and erodes trust in the advisory profession. The professional decision-making process for similar situations should involve a commitment to continuous learning and adaptation. Advisors should establish a routine for monitoring legislative updates from official sources like the Centers for Medicare and Medicaid Services, CMS, and relevant industry publications. When significant legislative changes occur, they should engage in a structured analysis. First, understanding the specifics of the legislation. Second, assessing its direct and indirect impacts on Medicare supplement plans and beneficiary choices. And third, determining how this information needs to be integrated into their client advisory process and communication strategies. This proactive and analytical approach ensures that advice remains compliant, relevant, and client-centric. Question 14. Quality control measures reveal that a Medicare supplement accredited advisor has not completed any continuing education specifically focused on Medicare supplement plan updates within the current compliance period, although they have completed general insurance ethics courses. Which of the following actions best ensures compliance with Medicare supplement accredited advisor, MSAA, continuing education requirements? Option A. Submit a request for a waiver of the Medicare supplement-specific continuing education requirement based on extensive experience in the insurance industry. Option B. Wait until the next compliance period to address the deficiency, as general insurance knowledge is broadly applicable. Option C. Rely on the completed general insurance ethics courses, assuming they cover sufficient ethical principles applicable to Medicare supplement sales. Option D. Immediately enroll in and complete approved Medicare supplement-specific continuing education courses that meet the required credit hours before the compliance period ends, and retain proof of completion. The correct answer is D. Immediately enroll in and complete approved Medicare supplement-specific continuing education courses that meet the required credit hours before the compliance period ends, and retain proof of completion. Explanation. This scenario presents a professional challenge because it requires an advisor to navigate the specific continuing education requirements for Medicare supplement Medigap plans, which are governed by federal and state regulations. Misinterpreting or neglecting these requirements can lead to non-compliance, potentially impacting the advisor's license and ability to serve clients. The core of the challenge lies in understanding the nuances of what constitutes approved CE and the reporting obligations. The correct approach involves proactively identifying and completing CE courses that are specifically approved for Medicare supplement insurance, ensuring they meet the required credit hours within the designated reporting period, and maintaining accurate records of completion. This aligns with the regulatory framework for Medicare Supplement Accredited Advisors, MSAA, which mandates ongoing education to ensure advisors remain knowledgeable about program changes, ethical practices, and compliance. The justification for this approach is rooted in the MSAA program's objective to uphold the integrity and competence of advisors serving Medicare beneficiaries. Failure to meet these requirements directly violates the terms of accreditation and state licensing laws governing insurance professionals. An incorrect approach would be to assume that any insurance-related CE course fulfills the requirement. This is a regulatory failure because Medicare supplement insurance has unique and evolving rules that general insurance CE may not cover. Another incorrect approach is to delay completing CE until the last minute or to rely on informal learning without verifiable course completion. This poses a risk of missing the deadline, leading to non-compliance and potential disciplinary action. Furthermore, failing to maintain proper documentation of completed CE courses is a significant compliance failure, as regulators may require proof of completion during audits or license renewals. The professional decision-making process for similar situations should involve a systematic review of the specific CE requirements applicable to Medicare supplement insurance, including any state-specific mandates. Advisors should consult official resources from the Centers for Medicare and Medicaid Services, CMS, and their state's Department of Insurance to identify approved CE providers and courses. Proactive planning, tracking of CE credits, and diligent record-keeping are essential to ensure continuous compliance and maintain professional standing. Question 15. Market research demonstrates that beneficiaries often struggle to understand the practical implications of different cost-sharing arrangements in Medicare supplement plans. When advising a client, which approach best reflects the regulatory framework and ethical obligations for a certified Medicare supplement accredited advisor, MSAA? Option A. Explain that Medicare supplement plans offer flexibility in cost sharing, allowing beneficiaries to negotiate copayment amounts with the insurance provider based on their individual healthcare needs. Option B. Focus primarily on the total annual premium cost of each plan, as this is the most significant financial factor for most beneficiaries, and briefly mention that copayments may apply. Option C. Detail the specific deductibles, copayments, and coinsurance for each covered service under the standardized Medicare supplement plans being considered, explaining how these apply after Medicare Part A and Part B benefits are exhausted, and how they differ between plans. Option D. Emphasize that plans with lower monthly premiums generally have higher deductibles and copayments, and advise the client to choose based on their perceived risk tolerance for out-of-pocket expenses. The correct answer is D. Emphasize that plans with lower monthly premiums generally have higher deductibles and copayments, and advise the client to choose based on their perceived risk tolerance for out-of-pocket expenses. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the nuances of Medicare supplement cost-sharing arrangements while adhering strictly to the Certified Medicare Supplement Accredited Advisor, MSAA, exam's regulatory framework, which is based on U.S. federal law and Medicare regulations. Advisors must understand how different cost-sharing structures impact beneficiary out-of-pocket expenses and plan selection, ensuring they provide accurate and compliant guidance. The core challenge lies in distinguishing between plans that offer more comprehensive coverage with potentially lower out-of-pocket costs for specific services versus those with higher deductibles or copayments but potentially lower premiums. The correct approach involves accurately explaining the cost-sharing differences between various Medicare supplement, Medigap plans, focusing on how deductibles, copayments, and coinsurance apply to covered services under each plan. This approach aligns with the MSAA exam's emphasis on understanding the structure and benefits of Medigap plans as defined by federal law. Specifically, it requires the advisor to detail how Plan G, for instance, covers the Part B coinsurance after the Part B deductible is met, while Plan F, which is no longer available for new enrollees, covered both the Part B deductible and coinsurance. Understanding these distinctions is crucial for beneficiaries to make informed decisions about which plan best suits their anticipated healthcare needs and financial situation, in compliance with Medicare's standardized plan offerings. An incorrect approach would be to generalize about cost sharing without referencing the specific structure of Medigap plans. For example, suggesting that all plans with lower premiums inherently have higher out-of-pocket costs without detailing the specific deductibles, co-payments, or coinsurance for each service under the standardized plans would be misleading. This fails to provide the concrete, plan-specific information required by Medicare regulations and the MSAA exam scope. Another incorrect approach would be to focus solely on the monthly premium as the primary cost factor, neglecting the significant impact of deductibles and co-payments on a beneficiary's total annual healthcare expenditure. This overlooks a critical component of cost sharing that directly affects beneficiary financial protection, a key aspect of Medigap policy design and regulation. Furthermore, discussing cost sharing in a way that implies flexibility or negotiation with the insurer, or suggesting that out-of-pocket costs are entirely discretionary, would be a significant regulatory failure, as Medigap cost sharing is standardized and fixed by federal law for each plan type. Professional decision-making in such situations requires a systematic process. First, identify the specific Medicare supplement plan being discussed. Second, recall or reference the standardized cost-sharing provisions for that plan as defined by federal Medicare regulations. Third, clearly articulate how deductibles, co-payments, and coinsurance apply to the services the beneficiary is likely to use. Finally, ensure all explanations are consistent with the information provided by Medicare and the plan's official benefits summary, avoiding any personal interpretations or generalizations that could lead to beneficiary confusion or misrepresentation. Question 16. Risk assessment procedures indicate that a Medicare Advantage plan is seeking to improve its star ratings. As a certified Medicare supplement accredited advisor, MSAA, what is the most appropriate process optimization strategy to recommend to the plan's leadership regarding their approach to enhancing star ratings? Option A. Prioritize the development of new plan benefits that are attractive to potential enrollees, assuming this will indirectly lead to better star ratings over time. Option B. Launch an aggressive marketing campaign highlighting perceived improvements in member satisfaction, even if not fully supported by current performance data. Option C. Focus on public relations efforts to emphasize positive anecdotal feedback from a small group of satisfied members. Option D. Implement a comprehensive data analytics program to identify specific operational areas impacting star rating measures. Develop targeted quality improvement initiatives based on this data, and continuously monitor the effectiveness of these initiatives. The correct answer is D. Implement a comprehensive data analytics program to identify specific operational areas impacting star rating measures. Develop targeted quality improvement initiatives based on this data, and continuously monitor the effectiveness of these initiatives. Explanation. This scenario is professionally challenging because it requires an MSAA to navigate the complex and evolving landscape of Medicare Advantage star ratings, which directly impacts plan performance, member satisfaction, and regulatory compliance. The advisor must understand how operational improvements translate into measurable rating improvements, and how to communicate this effectively without making misleading claims. Careful judgment is required to balance the pursuit of higher ratings with the ethical obligation to provide accurate and transparent information to Medicare beneficiaries. The correct approach involves a thorough understanding of the specific measures contributing to star ratings and how the plan's operational strategies directly influence performance on those measures. This includes analyzing data to identify areas for improvement, implementing targeted interventions, and monitoring their impact on star rating components. This approach is ethically and regulatorily sound because it is data-driven, focuses on genuine quality improvement, and aligns with CMS's objectives for the star ratings program, which are to incentivize plans to provide high-quality care and service. It avoids making unsubstantiated claims and instead focuses on the process of achieving better outcomes. An incorrect approach that focuses solely on marketing or promotional activities without a corresponding commitment to operational improvement is ethically flawed. This fails to address the root causes of lower ratings and can lead to misleading beneficiaries about the plan's actual performance and quality. It violates the principle of transparency and can create unrealistic expectations. Another incorrect approach that involves selectively highlighting positive data points while ignoring areas of underperformance is deceptive. This misrepresents the plan's overall quality and can lead beneficiaries to make enrollment decisions based on incomplete or biased information. This practice undermines the integrity of the star rating system and violates ethical standards of fair dealing. A further incorrect approach that relies on anecdotal evidence or testimonials without rigorous data validation to support claims of improved performance is also problematic. While testimonials can be persuasive, they do not constitute objective evidence of quality improvement and can be misleading if not supported by verifiable data. This approach lacks the rigor required for accurate representation of plan performance. Professionals should employ a decision-making framework that prioritizes data integrity, regulatory compliance, and ethical conduct. This involves 1. Understanding the specific star rating measures and their drivers. 2. Utilizing data analytics to identify performance gaps and opportunities. 3. Developing and implementing evidence-based operational strategies for improvement. 4. Accurately and transparently communicating the plan's performance and quality initiatives to beneficiaries, avoiding hyperbole or misleading statements. 5. Continuously monitoring performance and adapting strategies as needed. Question 17. The audit findings indicate that a Medicare supplement, Medigap, insurance agent, when assisting a client with a pre-existing heart condition, advised the client to not worry too much about listing it on the application, suggesting it might complicate the process. The agent's rationale was that the condition was stable and the client was not currently experiencing symptoms. Which of the following approaches best reflects the regulatory and ethical obligations of the agent in this scenario? Option A. The agent should advise the client that stable, asymptomatic pre-existing conditions do not need to be disclosed on a Medigap application to expedite the process. Option B. The agent should explain the importance of fully disclosing all health conditions, including the pre-existing heart condition, to the underwriting department and assist the client in accurately completing the application, regardless of the condition's current stability or symptom status. Option C. The agent should follow the client's lead and omit the pre-existing heart condition from the application if the client expresses a desire to do so, as the client is ultimately responsible for the information provided. Option D. The agent should focus solely on explaining the policy benefits and coverage options, deferring all health-related disclosure questions to the underwriting department without providing specific guidance. The correct answer is B. The agent should explain the importance of fully disclosing all health conditions, including the pre-existing heart condition, to the underwriting department and assist the client in accurately completing the application, regardless of the condition's current stability or symptom status. Explanation. This scenario is professionally challenging because it requires an advisor to balance the need for accurate and complete information with the client's potential desire to omit or downplay certain health conditions. The advisor must understand that Medicare supplement, Medigap, insurance underwriting is heavily reliant on the applicant's health status at the time of application. Misrepresenting or omitting information can lead to severe consequences, including policy rescission and potential regulatory penalties. The advisor's primary ethical and regulatory obligation is to ensure the client understands the importance of full disclosure and to guide them in providing accurate information, even if it might lead to a higher premium or denial of coverage. The correct approach involves thoroughly explaining the underwriting process for Medigap policies, emphasizing the critical role of accurate health information on the application. This includes detailing the potential consequences of non-disclosure or misrepresentation, such as policy cancellation or denial of claims, and the applicant's responsibility to provide truthful answers. The advisor should then assist the client in completing the application accurately, encouraging them to disclose all relevant health conditions, even those they might consider minor or resolved. This aligns with the regulatory framework governing insurance sales, which mandates honesty and fair dealing, and the ethical duty of an advisor to act in the client's best interest. An incorrect approach that involves advising the client to omit or downplay pre-existing conditions, even if the client expresses a desire to do so, constitutes a direct violation of regulatory requirements and ethical standards. This action could be construed as aiding and abetting misrepresentation, which carries significant penalties for both the client and the advisor. Another incorrect approach would be to simply accept the client's incomplete or inaccurate information without further inquiry or explanation. This demonstrates a failure to exercise due diligence and uphold the advisor's responsibility to ensure the application is complete and truthful. Failing to explain the implications of non-disclosure also breaches the duty to inform and educate the client, leaving them vulnerable to future problems. Professionals should approach such situations by prioritizing transparency and education. The decision-making process should involve 1. Understanding the client's concerns and motivations for potentially withholding information. 2. Clearly and comprehensively explaining the regulatory requirements and the underwriting process for Medigap. 3. Articulating the potential negative consequences of incomplete or inaccurate disclosure. 4. Guiding the client through the application process, ensuring all questions are answered truthfully and completely. 5. Documenting the conversation and the client's decisions regarding disclosure, especially if they choose not to disclose information that the advisor believes is material. Question 18. The monitoring system demonstrates that a Medicare beneficiary who has a qualifying disability and is currently employed has inquired about Medicare supplement insurance options. The beneficiary's income is at the upper limit of what is considered for certain Medicare savings programs, but the specific income thresholds for the qualified disabled and working individuals (QDY) program have not yet been confirmed by the advisor. Which of the following represents the most appropriate course of action for the advisor? Option A. Advise the client that their disability and employment status likely qualify them for the QDY program and proceed with enrollment in a suitable plan. Option B. Inform the client about general Medicare supplement plan options and suggest they research QDY program eligibility independently. Option C. Recommend a standard Medicare supplement plan, explaining that QDY is a complex program with limited availability and may not be the best option. Option D. Thoroughly review the specific income and disability criteria for the QDY program with the client to determine their precise eligibility before recommending any specific plan. The correct answer is A. Advise the client that their disability and employment status likely qualify them for the QDY program and proceed with enrollment in a suitable plan. Explanation: this scenario is professionally challenging because it requires an advisor to navigate the specific eligibility criteria for the qualified disabled and working individuals QDY program, which is a crucial component of Medicare supplement insurance for a particular demographic. Misinterpreting or misapplying these criteria can lead to significant financial and coverage gaps for the client, potentially resulting in regulatory scrutiny and damage to the advisor's professional reputation. The advisor must possess a thorough understanding of the program's nuances beyond general Medicare eligibility. The correct approach involves accurately identifying that the client's specific disability status and income level, as defined by the QDY program guidelines, are the primary determinants for eligibility. This requires the advisor to consult the official QDY program regulations and guidelines to confirm if the client meets the established thresholds for disability and income. By adhering strictly to these defined program parameters, the advisor ensures that the client receives accurate information and is guided towards the appropriate coverage options, upholding their ethical duty to provide competent and truthful advice. An incorrect approach would be to assume that because the individual has a disability and is working, they automatically qualify for QDY benefits. This fails to recognize that QDY has specific income limitations that must be met, in addition to the disability status. This oversight represents a regulatory failure by not applying the full scope of the program's requirements. Another incorrect approach would be to advise the client to enroll in a standard Medicare supplement plan without first verifying QDY eligibility. This is a failure to act in the client's best interest, as QDY offers a specific pathway for individuals who might otherwise face higher premium costs or limited enrollment periods. By not exploring the QDY option, the advisor is not providing comprehensive advice tailored to the client's unique situation. A further incorrect approach would be to provide general information about Medicare eligibility without specifically addressing the QDY program's unique requirements. While general Medicare knowledge is foundational, it is insufficient when a specific program like QDY is relevant. This demonstrates a lack of specialized knowledge and a failure to provide targeted guidance. The professional decision-making process for similar situations should involve a systematic review of the client's circumstances against the specific requirements of all relevant Medicare supplement programs, including specialized ones like QDY. This includes actively seeking out and understanding the detailed eligibility criteria, income limitations, and enrollment rules for each program. When in doubt, consulting official program documentation or seeking clarification from regulatory bodies is paramount. The advisor must prioritize accurate assessment and client-centric guidance over assumptions or generalized advice. Question 19. The efficiency study reveals that a common practice in serving Medicare supplement needs for residents in long-term care facilities is to streamline the enrollment process by relying heavily on facility administrators to disseminate plan information and gather initial resident preferences, which approach best upholds the regulatory framework and ethical obligations for a certified Medicare supplement accredited advisor, MSAA, when serving these individuals. Option A. Delegating the primary responsibility of educating residents about Medicare supplement plans and collecting their enrollment choices to the long-term care facility's administrative staff. Option B. Focusing on promoting plans with the highest commission rates, as these are often perceived as offering the most comprehensive benefits and encouraging residents to select these options. Option C. Presenting a standardized package of the most popular Medicare supplement plans to all residents, assuming their needs are generally uniform due to their living environment. Option D. Conducting a personalized needs assessment with each resident, explaining plan options in clear, simple language, and obtaining direct consent from the resident or their authorized representative, while respecting their privacy and autonomy within the facility setting. The correct answer is D. Conducting a personalized needs assessment with each resident, explaining plan options in clear, simple language, and obtaining direct consent from the resident or their authorized representative, while respecting their privacy and autonomy within the facility setting. Explanation. Serving individuals in long-term care facilities presents unique challenges for Medicare supplement accredited advisors, MSAAs. These residents often have complex health needs, limited mobility, and may rely on facility staff for communication and decision-making support. Advisors must navigate these sensitivities while ensuring residents receive appropriate Medicare supplement coverage that aligns with their current and anticipated healthcare needs. The professional challenge lies in balancing the need for thorough needs assessment with the resident's comfort, privacy, and potential cognitive limitations, all while adhering strictly to CMS regulations and ethical standards for Medicare supplement sales. The correct approach involves a structured, resident-centered process that prioritizes clear communication and informed consent. This includes conducting a comprehensive needs assessment, explaining plan options in easily understandable terms, and ensuring the resident, or their authorized representative, fully comprehends the benefits, costs, and limitations of each plan before enrollment. This approach directly aligns with CMS guidelines that mandate accurate and fair marketing practices, prohibiting misleading statements and requiring advisors to act in the best interest of the beneficiary. Ethical considerations demand that advisors respect the resident's autonomy and avoid any form of undue influence or pressure, especially given the vulnerable nature of individuals in long-term care. An incorrect approach that involves solely relying on facility staff to relay information and obtain consent is ethically and regulatorily unsound. This bypasses direct communication with the beneficiary, potentially leading to misunderstandings or misrepresentations about coverage. It violates the principle of informed consent, as the resident may not have received the information directly or had the opportunity to ask clarifying questions. Furthermore, it risks violating CMS marketing rules by not ensuring the beneficiary fully understands the product being offered. Another incorrect approach is to present a limited selection of plans without a thorough needs assessment, assuming all residents in a facility have similar needs. This fails to acknowledge the individuality of each resident's healthcare situation and potential future needs. It can lead to recommending inappropriate coverage, which is not in the beneficiary's best interest and could be considered a misrepresentation of the product's suitability. This also falls short of the due diligence required by CMS to ensure beneficiaries are enrolled in plans that meet their specific circumstances. Finally, an approach that focuses on upselling higher premium plans without a clear justification based on the resident's documented needs is also problematic. This prioritizes potential commission over the beneficiary's actual needs and financial capacity, violating ethical standards and potentially CMS guidelines regarding fair marketing and suitability. Advisors must always recommend plans that are appropriate for the individual's health status and financial situation. The professional decision-making process for similar situations should begin with a commitment to the beneficiary's best interest. This involves understanding the specific regulatory environment, CMS guidelines for Medicare supplement plans, identifying potential vulnerabilities of the population being served, and developing a communication and assessment strategy that is both compliant and ethical. Always prioritize direct communication with the beneficiary. Ensure clear and understandable explanations. Obtain informed consent, and document the entire process meticulously. When dealing with individuals in long-term care, be prepared to involve authorized representatives when necessary and appropriate, but always strive for direct engagement with the resident to the greatest extent possible. Question 20. Compliance review shows that a client is inquiring about how their Medicare supplement, Medigap, policy might assist with potential future long-term care expenses, such as nursing home stays or assisted living facilities. Which of the following approaches best aligns with the regulatory framework and ethical obligations for a certified Medicare supplement accredited advisor, MSAA? Option A. Assure the client that their Medicare supplement policy will provide substantial coverage for nursing home and assisted living expenses, as it complements original Medicare. Option B. Recommend that the client rely solely on their Medicare supplement policy for all future healthcare needs, including long-term care, as it is a comprehensive plan. Option C. Detail the specific benefits of the Medicare supplement policy for hospital stays and doctor visits, without directly addressing the client's long-term care concerns. Option D. Explain that, while Medicare supplement policies cover gaps in original Medicare for medical services, they do not provide coverage for long-term custodial care or extended care services, and that a separate long-term care insurance policy is designed for those needs. The correct answer is D. Explain that while Medicare supplement policies cover gaps in original Medicare for medical services, they do not provide coverage for long-term custodial care or extended care services, and that a separate long-term care insurance policy is designed for those needs. Explanation. This scenario is professionally challenging because it requires an advisor to navigate the complexities of long-term care, LTC insurance, specifically concerning the interplay between Medicare supplement, Medigap, policies and standalone LTC policies, while adhering strictly to the Certified Medicare Supplement Accredited Advisor, MSAA, exam's regulatory framework. The core challenge lies in accurately advising a client on how these distinct insurance types function, what benefits they cover, and crucially, what they do not cover, to prevent misrepresentation and ensure the client makes an informed decision that aligns with their actual needs and the limitations of their coverage. The correct approach involves clearly differentiating between the benefits and limitations of Medicare supplement policies and standalone long-term care insurance. Medicare supplement policies are designed to fill the gaps in original Medicare Parts A and B coverage, such as deductibles, copayments, and coinsurance. They do not, however, provide coverage for long-term care services like nursing home care, assisted living, or home health care beyond what original Medicare covers, which is typically limited to skilled nursing facility care for a short period after a qualifying hospital stay. Standalone long-term care insurance policies are specifically designed to cover these types of services. Therefore, an advisor must educate the client that a Medicare supplement policy, while valuable for medical services, will not pay for the custodial care or extended care services that are the primary concern for long-term care needs. This approach ensures the client understands that a Medigap policy is not a substitute for dedicated LTC coverage, and that purchasing a separate LTC policy is necessary if those needs are to be met. This aligns with regulatory requirements for accurate product representation and ethical obligations to act in the client's best interest by providing complete and truthful information. An incorrect approach would be to imply or state that a Medicare supplement policy offers any significant coverage for long-term care services. This is a direct misrepresentation of the policy's benefits and a failure to adhere to the regulatory framework governing Medigap sales. Such an approach would mislead the client into believing they have coverage for long-term care needs when they do not, creating a significant gap in their financial protection and potentially leading to substantial out-of-pocket expenses. This violates the principle of accurate product disclosure and the ethical duty to ensure client understanding. Another incorrect approach would be to focus solely on the benefits of the Medicare supplement policy without addressing the client's stated concern about long-term care needs. While the Medigap policy may be beneficial for other reasons, ignoring the client's specific inquiry about LTC coverage demonstrates a failure to fully address their needs and concerns. This can be interpreted as a lack of due diligence and a failure to provide comprehensive advice, potentially leading the client to believe their LTC concerns have been adequately addressed when they have not. A third incorrect approach would be to recommend a Medicare supplement policy as a primary solution for long-term care expenses without clearly explaining that it does not cover the majority of such costs. This conflates the distinct purposes of the two types of insurance and fails to provide the client with the necessary information to make an informed decision about securing appropriate long-term care coverage. This misrepresentation of coverage is a serious regulatory and ethical breach. Professional decision-making in similar situations requires a thorough understanding of all insurance products being discussed, a commitment to transparent and accurate disclosure, and a client-centric approach that prioritizes addressing the client's stated needs and concerns. Advisors must be prepared to explain the differences between various insurance products, their respective benefits and limitations, and how they may or may not address specific risks, such as long-term care needs. This involves active listening, clear communication, and a dedication to ensuring the client fully comprehends their coverage options and their implications.